coming in every day. Every day it's another country or a continent. But Gauri, we need to really set the record straight. Over to you.
That's right, Sanjana. So there are a lot of unconfirmed news, fake news, unconfirmed WhatsApp forwards or social media posts that are doing the rounds and basically adding to the panic. So we have, what we have done is that we have collated certain myths that are going around and have also tried to put out the fact, the truth, so that people don't fall prey to it. First, number one myth that is going, that is actually people are believing is that hand dryers, which we usually found in public restrooms, are effective in killing coronavirus, but the fact is that you should wash your hands with soap and water first and then use paper towel to dry your hand, and do not use hand dryers because they are not going to kill coronavirus at all. Myth number two, of course, we'll try and show another myth that is doing the round, and that is that UV disinfection lamp can kill coronavirus. But the fact is that UV radiation only causes skin irritation, and it is not advisable at all to use UV disinfection lamp to detect coronavirus, because it is not going to kill it, and do not expose your skin to UV rays. Myth number three. Thermal scanners can detect coronavirus. Another myth, another fake news that is doing the rounds. But the thing is that thermal scanners can detect people with fever, and they cannot be used to detect coronavirus. So this is another myth that people are believing in. Myth number four is that is it safe to receive a package from China or any other country which is hit by coronavirus? The fact is that coronavirus does not survive on objects, so it is extremely and completely safe to receive parcels or packages from China or any other country which is hit by coronavirus. Myth number five, that pets can spread coronavirus, but no evidence yet is there that shows that pets can be infected or any other animal can be infected with coronavirus. So your pets are safe. Do not worry about it. Myth number six, vaccines of pneumonia can actually protect you from coronavirus. But the fact is, the truth is that coronavirus is so deadly that it requires its own vaccine, and it's still in the works. No vaccine has been developed yet. And myth number seven, regularly rinsing your nose with saline actually prevents coronavirus. But the fact is that no such evidence is there that rinsing a nose with saline actually will protect people from coronavirus. Myth number eight, eating garlic prevents coronavirus attack. But the fact is, no evidence actually prove that eating garlic is going to prevent coronavirus attack. Myth number nine, coronavirus only affects older people or elderly people. But the fact is that it is not about age. It can actually affect any age group, and people of all ages are equally vulnerable. Another myth is myth number 10, avoid public transport or large gathering. Of course, it is being advised by government and various experts, but the thing is that you can do all of those things. You can travel in public transport and attend public gatherings, but do take precautionary measures. Myth number 11, that face masks are going to protect you from coronavirus, but the fact is that viruses can also enter through your eyes. So masks or face masks which people are using are not the ultimate barrier.
Right, Gauri, thank you so much. And of course, one of the other ones that actually has been doing the rounds and, has impacted business more than usual. If this outbreak wasn't bad enough to, of course, put fear in the tourism industry and lots of other businesses and trades, is of course, eating chicken and eating meat, and whether that could actually spread coronavirus. Shubham, let me come to you, since you are obviously, I can't really call it the epicenter, but closer, much closer to the epicenter, to the outbreak. What kind of rumors really do you feel? I remember you were talking about how you've been getting WhatsApp forwards, and that is really the fallacy, of course, that all of us have to deal with. But, if I were to ask you, sitting there in Beijing, what are some of the biggest rumors that actually need to be put to rest when it comes to India dealing with the outbreak?
Yes, most of the, I think, rumors you have already shown, and I must appreciate the way you have put together this show. This was the need of the hour, and I must say, one of the facts, like I have been, a lot of people from India, they're telling that, don't eat chicken. We're not eating chicken. We're not eating fish and all. But, trust me, like here, like since January, February, and this is March, I have been regularly eating chicken, mutton, even fish, and everything regularly, and eggs. The one good thing about India, I believe, is our
Hmm.
food habit. Because we Indians, we believe in like well cooked, well done food. So we hardly eat like anything raw. Like in China and Japan, like
Right.
people eat a lot of raw stuff, like sushi in Japan. You have a lot of it's not well done, it's not well cooked. But
Right.
in India, we mostly prefer well cooked, well done food. I think that is very important. And if you really like the way we prepare any non-vegetarian delicacies, so it's always well cooked, well boiled, and all. So that will definitely, that's not gonna damage anything. One is this. Other thing is about, of course, receiving parcels. So that's something which is actually I've been reading a lot about it from Indian WhatsApp forwards.
Right.
But that's also another thing I tell you, because in a country like China, where delivery industry is the one of the service and delivery industry is one of the biggest industry and most efficient in the world.
Hmm.
So we have been kind of surviving, I would say, on deliveries, like for everything from getting basic raw materials for raw vegetables, food, anything and everything. Where like the delivery boys are always like they're working round the clock. We are getting deliveries, home deliveries from them. Even food, like in India, you have those companies like Zomato and all the who deliver food. In China, we have like bigger companies with bigger operations. So we are ordering food at home. So there shouldn't be any, this kind of rumors that getting deliveries, parcels, couriers can actually infect you. That's absolutely rubbish, I would say. And eating chicken meat, as you said, like that's absolutely ridiculous. Well done, well cooked food, having that is always good. And Indian context, I can tell another thing, which is everybody has to be a little careful of that. That's we eat a lot of street foods in India,
Hmm.
especially cut fruits and all. I think those are the things which can be avoided because that's not good. But yeah, I'm not saying that you should boycott street food. If it's well cooked, well done, then it's absolutely fine. I don't see any problem. The doctors in the panel, they can elaborate a bit, in a better way. But I believe like these days, these are the prime rumors about the courier parcel delivery thing, and the other thing is the non-vegetarian products. So these are the basic, like the most common WhatsApp forwards I'm getting. And that's why I want to assure all of you, like every day I've been surviving having chicken, mutton every day. Like, that's not a problem at all.
Right.
Yes, Anjana.
Just wash your hands, as we've been saying since this show has
Yeah.
begun. So, Dr. Mehta, another report that has been doing the rounds, and that Gauri rightly pulled up, and what we've also been discussing is the fact that perhaps this is more prevalent in elderly people, because we saw even on the cruise that was quarantined, the people to pass were actually an elderly couple from Japan. Even most of the China deaths are elderly people. Is it because the immune system is actually lower in people who are obviously, elderly, therefore, and hence more prone to some kind of infection or disease? Or, is there any truth to this? Because we're out here trying to bust myths, really. So, give us a sense behind that.
Sure. I think it's a very good question. And I'd like to differentiate infection from mortality. The thing is that this infection can go across all ages, and it has been said that it is more prevalent, the infection, that means the virus, in the younger people, because they're the ones who are out there more in society, holding hands, holding objects, or talking to each other, but they get the milder version. In the elderly, they are the ones who succumb more to the complications of the disease, and that's exactly because of what you said. Them being weaker, already having comorbidities. So imagine a person who's, say, about above a certain age, be it 80 or whatever, already has a weak heart, has weak lungs, cannot take the insult of the disease, and they tend to succumb more. So the frequency of the disease is the same. The side effects and the complications, mortality, may be higher in the elderly if they carry other problems or other illnesses along with them. So if they have weak organs, there's a greater chance that they will suffer more. But everybody can get it.
Okay. Dr. Saxena, I'm going to have to wrap in some time, but let me ask you, because especially for professions like ours, for journalists and for reporters who may not always have access to running water or soap, and then may of course want to use sanitizers, or may want to use other methods, then is that as effective, would you say?
Yeah, they have been equally effective, and actually, the alcohol based sanitizers have been recommended for the people like you who are working professionals and do not have an access to the water and soap very frequently. They can always have. There have been very different types of hand sanitizer, alcohol based sanitizer, alcohol free sanitizers, and so on. You just simply rub, just like a pen, on your hand, and then simply rub your hands, and you are through. So, there have been so many options available in the market where people can go and have these things in the various things. One thing I was again bringing to the context is a lot of thing has been said about the mask.
Right.
Mask is something which we have to be very careful when we are talking about the corona infections, because if we are using N95 mask, then the wearing the mask has a meaning, specifically for these kind of viruses who are in the micron size or nano size, because just in a very crude way, if I have to say, on the tip of one needle we can have more than 1 million coronaviruses. So you can think of how minute the virus is. So if you are wearing a mask, then only have the N95 mask. They have been available in the medical stores very properly if you ask them. And when I say N95 mask, means that the 95% of the air which you are going to take from the outside is purified. So that means the risk has been minimized by more than 95%. So that's the beauty of having the N95 mask.
All right, all right. And Dr. Saxena, of course, using what you're saying as just to find out more, like you said, that it can be only an N95 mask. Can it not be any other mask that is worn? And more importantly, there are also reports about the side of the mask that one actually needs to wear. If you can, dwell on that a little.
Yeah, normally we suggest that the size of the mask should be as per your face. But getting the customized mask is not that very easy in India, although there have been a couple of the masks which do have the aluminum foil inside, which simply makes your face completely covered off. But that is mostly required for those people who are immunocompromised, or like just we had a case who has the liver transplant, or something where the chances of getting the infection or the risk is very high for those patients. But normally, even if you take the normal mask, which is N95, and your face is completely covered, that is more than sufficient, specifically when you are going to a high risk area. Again, this is not supposed to be worn every time when you are meeting to the healthy person also.
Right, Dr. Shailendra Saxena, Dr. Sanjeev Mehta and Shivam Pal in Beijing. Thank you so much for joining us this evening, and thank you to our viewers for joining us as well. Let's remember cold and flu season. It's already the time to be, careful, more aware. But when it comes to taking care of yourself, now with the outbreak of coronavirus and of course 3 fresh cases being reported in India, and as it continues to dominate headlines, it is important that we not only cut through the noise, but also equip ourselves with the knowledge and take care of our health. Number one, let's not